Here we go. Good morning and welcome to the WellMed Charitable Foundation Caregiver Teleconnection series. Today we have a wonderful presentation called The Flu and You by Dr. Elliot Montgomery Sklar. I want to tell you a little bit about him and why he's such an expert in this field. He's an associate professor of health science at Nova Southeastern University in Florida. He's worked as an educator, researcher, and leader of community and home-based healthcare programs in the US and Canada for over 15 years. He has a doctorate degree in public health, teaches disease outbreak and investigation, which has been central to the COVID-19 pandemic. And since the pandemic began, he helped to facilitate programs to support caregivers during this time for the WellMed Charitable Foundation, the American Public Health Association, and for senior living communities across the country. And we're not even mentioning all the virtual work he does, which is probably across the world. So, Dr. Sklar.
Thank you so much. So exactly as you were mentioning, for the last couple of years, our focus has really been on COVID-19, which is certainly still affecting us. But this winter, it's flu and colds that have been on my radar. So much so that several weeks ago, I had reached out to the foundation to offer to do a program dedicated about the flu, specifically for caregivers, really. And it seems like we were right on the money with this, because if you've been watching the news the past couple of days, a lot of headlines, even from the Weather Channel, have focused upon our flu outbreak, and also the triple whammy of flu, RSV, which we'll talk about, a respiratory virus, and COVID. So without further ado,
That was good.
I got the most recent weekly map of influenza. This is a heat map from the CDC. And as you can see, the flu activity across the majority of the country is very high, especially in California, in Texas, and it's now moving northward. Interestingly enough, this year, it seemed that the flu started really in the south. It was something we were talking about earlier in the fall, and those places are now seeing very high rates of flu outbreak. And this information is really important for caregivers, but I think also for all of us, especially as we age or if we're living with chronic illness. Our immune systems as we age are not as strong as they used to be. And in addition, because many of us have been taking precautions by wearing masks and distancing the last couple of seasons, the flu is back this year with a vengeance because many of us have let those guards down. It's actually the largest outbreak of flu that we've had in over a decade. And hospitalizations are quite high at this point in the season. Now, what's worse is that you should get your flu shot by the end of October. But data, including data I looked at this morning, is indicating that vaccination rates are lower this year. So if you have not gotten your flu shot, please do get it. Please don't wait. It is exactly 3 weeks until Christmas, and a flu shot takes about 2 weeks to work. So anyone who is 6 months of age or older in the United States is eligible to get a flu vaccine with rare exception. And the CDC is going to be releasing data on the number of people vaccinated on December 9th. So we still have a couple of days away, but their last update, which was as of October 1st, showed that only 14.6% of Medicaid and Medicare beneficiaries who were 65 years of age and older were vaccinated. It's a really low number. Last year, around 40% of all adults got a flu shot across the entire flu season. So the question that always comes up is, even if you get the flu vaccine, can you still get the flu? And the answer is yes, much like the COVID vaccine. But the goal of the vaccine is to prevent, again, against the most severe outcomes and complications. Many people were very concerned when we learned that the COVID vaccines were not 100% effective and that you could still get sick. The flu vaccine is actually only about 60% effective, give or take, and it works in a very similar way. I had a great question from a student in one of my classes the other week asking why these vaccines did not provide better protection. And it was a great question to me because if you think about things like polio or measles, mumps, rubella, the MMR vaccine that children get, we don't have a lot of these things circulating around us. So the student's question was a valid one. Does it mean that those vaccines are more effective than our flu or COVID vaccines? And the answer is not as simple. It varies. And the reason being is that nowadays we don't have a lot of polio in our communities. We don't have a lot of measles, mumps, and rubella. And that's because people have systematically over time as children been required to get those MMR shots in order to attend school. So by virtue of that, we don't have the community transmission rates of those things as we do with things like the flu. And if there's more flu around, then that flu vaccine will be even less effective. If there's less flu around, then that flu vaccine will be more effective with that thinking. So as we know by looking at this map that there is such high level of flu infection, and this was as of the end of the week, November 26th, I imagine it's higher now since Thanksgiving because people were together. It creates more opportunity for transmission and spread. And because people are not getting vaccinated across the board, we will have more breakthrough infections among people who are vaccinated. And that is really where public health takes the focus on the public, because our individual actions are impacted by the behavior of others and vice versa. So this flu season is bad, in part because of the flu virus itself being so virulent, but also because people have been dealing with COVID for 3 years and feel like the flu is small potatoes. But to this point, 4,500 people this season have already died from the flu, according to CDC data. And that's why we are meeting today. I'm here to answer any questions that you have. And really, we're going to talk about what you can do to best protect yourself and your loved ones. I have spent the past 2 weeks going through information from the CDC, the AARP, gerontological societies worldwide, and I'm going to present the information most pertinent for our caregivers, especially ahead of the holidays. And I'm saving one piece of advice for the end of our program today for those who are most concerned about getting the flu.
Dessert.
It's actually, I'm sorry?
Dessert.
Dessert, yes. But if you are most concerned about getting the flu, and I know some people listening today might be, there's one thing that you can do that is the most effective thing to actually protect yourself from the flu. So we're going to talk about that. But I was wondering, before we get into the nitty-gritty of science, does anyone have any questions to begin?
You can unmute yourself if you're on the phone by pressing *6, or just unmute yourself on Zoom if you're zooming in, or use the chat box, or put your hand up. We would love to hear from you.
We will also be providing a copy of our presentation, and the link that you see underlined here is a hyperlink. So if you get a copy of the handout and you want to know the most up-to-date flu activity in your area, you'll be able to click on that link and come up to that data.
Great. Thank you. Okay.
Well, we'll keep going. So I mentioned RSV. RSV is a respiratory virus. It is most common in children, but we're seeing a lot of adults get it. And tracking for RSV is not like the flu. There is no weekly heat map, but data is available state by state. And COVID tracking no longer reflects all cases because so many people are testing at home. So these are complications for us in terms of what we know about what's going on in our communities. It makes it harder for everyone to make sense of. The data that is available, and again, you can see here below, I have some information on COVID as it is currently being reported. And if you look at that vaccination rate for the updated booster among people 5 years and older, it's only 12%. So it's almost 13%, but still very low. The data that is being collected and reported on RSV and on COVID is intended more for clinical use to help doctors. And it's alarming to me in a way, but COVID cases stopped being tracked in the way that they used to. And I've included this snapshot of the data here from the CDC's website, which I accessed yesterday. And hospitalizations are up, even though it looks like cases remain pretty stable. But because people are testing at home, that data doesn't always get counted into the data unless they report it to their local health department or their doctor. And this is something I talked about a long time ago as one of my concerns about in-home testing. Wastewater in counties are revealing very high COVID rates. And in some places like Los Angeles, there's even talk of a possible return to mask mandates. So again, you have the link here. I'm not going to bring you to it because it looks like very complex level of data, but what is being reported on a positive is that the majority of flu cases are influenza A, which is one of the strains that is included in our flu vaccine this year. And I'll talk a bit more about that later in our program. I wanted to share something personal. As some of you know, and as Evelyn shared, I live in Florida. This is where I'm a full-time professor. And up until about a decade ago, I didn't used to get the flu shot. And I thought that I knew enough as a public health professional that if I got flu symptoms, I could go and get Tamiflu, which is a medication that is used to shorten the duration and lessen the symptoms of the flu if you catch it in the first 48 hours. And I thought that was very smart thinking. And in 2013, I had relocated back from Montreal to Florida and drove with my spouse and our pets. And we drove to my spouse's family's home in Maryland, and we were celebrating because we were moving back to Florida. And this was in late March. So it's at the end of flu season. And the plan was that his parents were going to meet us in Florida. They were flying. We were driving. We were all going to meet and have a wonderful time, and again, celebrate the fact that we were moving back to the warmth and the sunshine. And after the first night at his parents' home, we thought we had the worst hangover in the world, but it didn't make sense because we had only had 1 or 2 glasses of wine. And our symptoms continued to progress as the day went on. Long story short, my father-in-law took us to an urgent care center where we both tested positive for the flu. We wound up staying in their home while they flew to Florida, and we were recovering. Fortunately, we did get Tamiflu, but that was the last time I had the flu. And I will tell you how awful of an experience it was. And at the time I was in my 30s, I was young. And ever since then, I have made it a point of getting the flu shot because I never wanted to feel that way again. 1 year, I actually still did get the flu after getting a flu shot. I was working with homeless healthcare centers, and these facilities tend to, house a lot of people in one space. And so I was always very diligent about getting my flu shot, but it was a season in which we had a really bad outbreak. But I will say again, from personal experience, that time that I got the flu, it was not as bad, which I do think I credit to the flu vaccine. But I was just curious if anyone has any personal experiences that they wanted to share, or any concerns that they have about the flu vaccine.
Go ahead, folks, unmute yourself by pressing *6 if you're on the phone, or you can just talk to us by unmuting yourself on Zoom. We really love to hear your questions, and nobody enjoys answering them more than Dr. Sklar.
Well, if anything comes up again, we'll continue asking questions, but you can also use the chat box. I think a lot of people are actually hesitant to admit concerns that they have about the flu vaccine. And the reason I say that is because of the low vaccination rates that we're seeing. So I really encourage people to embrace knowledge as much as you can to make educated decisions. I had talked about our low vaccination rates, but to be honest, I can't say that I'm surprised. Many of us, I think, feel like science has failed us. We are 3 years into the COVID pandemic and still figuring it out. We don't know the long-term effects of our COVID vaccines, and there's endless amounts of boosters that we seem to be advised to be getting. I also showed that data about the booster rate and how low it is. The guidance keeps changing. And so I'm not surprised that flu vaccine rates are lower and that people are not rushing to get their COVID boosters. If you think about it, pharmacies would not be handing out gift cards for getting vaccinated if everyone was clamoring to get their shot. And I don't know about you, but when I got my flu shot at my grocery store pharmacy, I got a $20 gift card to shop there.
I only got 10.
They really are trying to incentivize people. It might have been because I got my booster at the same time, so it might have been 10 and 10. But the thing of it is, science has not failed us. Actually, this is how science works. We discover facts, we learn new things change course, and they shift. I used to teach medical students full-time, and I used to teach family medicine. And what I learned in my decade of teaching in a medical school is that about half of the things that doctors are taught during the course of their schooling is found to be incorrect over the course of their career. So it's not to say that we are teaching something right now that isn't correct, but rather that science does better as science knows better. And I hope that, we as people do the same. What I taught our students was that we have to be lifelong learners. And that's the best way that we can continue to decipher good news from bad news, how to weigh pros and cons, both with ourselves, with our care recipients, and with patients we might be caring for when we decide upon treatment plans or prevention. We have to think of everything as having a pro and a con to it, or there has to be a risk-benefit analysis. For example, we kept people in long-term care facilities in quarantine, isolated away from loved ones. Now, we've learned that that came at a cost to people's quality of life, their mental health, and that's true for caregivers who were distanced from their loved ones as well. So it's cost-benefit analysis. What's better, what's worse? And what is good for one person might not be good for the other, and vice versa. I think this is also true for caregivers. And I've been trying to teach the same thing, really, I think, over the course of the pandemic, is to caregivers how to decipher good information from bad. So I would encourage people to look at different news outlets. If you have friends or family who are forwarding things to you and they're not correct, you don't have to necessarily correct them, but look at the sources. I had a cousin who sent something about COVID death rates being higher among people who were vaccinated. And I looked at the study, and it looked like a very credible study. And I'm a professor. This is what I do all day. And it was financed by a foundation. And when I went to go look at the foundation, it is a libertarian foundation started by extremists with very radical views. So the information might look credible, but it was not. And again, I encourage people to look to NPR, the BBC in the UK, if you want a different perspective, or CBC News in Canada. And also to look at the actual CDC data. It might be flawed, but I think sometimes it's helpful. Just looking at that graphic map that I showed at the beginning of our program, to me, that signals an alarm to me when I see a map that is full of those colors and not yellows and greens. So I think knowledge helps to give us what we need to be able to act in terms of prevention and making other decisions. One of those decisions is the flu shot. And as I said, I think a lot of people are uncomfortable about sharing their concerns. And I say that because, again, flu vaccine rates are pretty low. So we have a couple of myths and flu facts here that I welcome you to peruse through. I'm not going to read them. But again, do flu shots come with risks? Sure they do. Everything does. And if that's what is holding you back, then please have a discussion with your doctor or pharmacist. Do your due diligence. Ask the questions that are of concern to you. Vaccinations really are the cornerstone of public health. If you take a public health history class, it's one of the first things that we learn. We don't allow our children to attend schools without vaccines, as I mentioned. So why is the flu shot so controversial? Many people don't realize that the first time that the CDC had actually recommended the flu shot universally for healthcare workers, anyone want to take a guess upon what year that was? You can enter it in the chat box. What year did the CDC start to begin to recommend flu shots for all healthcare workers? Well, it was in 1981. So it has been over 40 years now. So it's a very long time. And yet not all healthcare systems require that their employees get vaccinated for the flu. The reasoning is that when a caregiver gets immunized, they also decrease the risk of transmitting the flu and spreading disease in the community. Now, there are some myths about flu shots that I think people feel some sense of concern about. Some people actually think that you can get the flu from the flu shot because many people do get sick after getting the flu shot. For a couple of years, what I realized before our COVID precautions and when I was working on a campus is that I did sometimes get sick for a couple of days just after getting the flu shot. And that's because when you get a flu shot, your immune system is busied. It's occupied in trying to create immunity against the flu. And so it makes you more susceptible to catching other things. The reality is that viruses in the vaccines themselves have been deactivated and tested. And a lot of people believe that if you're healthy, then your body's own immune system is enough to fend off the flu. But the flu doesn't discriminate. Germs don't look for specific hosts. They're not very picky. They don't have a penchant for thin blonde types, you know? So what I have here is something called the epidemiologic triangle. It can be a lot to say, but I'm going to provide a really quick lesson in disease outbreak that's actually really simple. So in very simple terms, you need three things present in order for there to be disease spread. You need to have a host, an agent, and the environment. So, for example, what we learned with COVID was that it spread through respiratory droplets, and we learned that being outdoors was better because of ventilation, and it also allowed for more social distancing, which were helpful in curbing the spread. So in that case, COVID was the germ, the host is a person, but the outdoor environment and social distance was less conducive to spread. So when you remove one component of this triad, it makes it unable for the virus to spread. And in that case, it was environment. So if a host gets vaccinated, for example, the host becomes less susceptible to catching the flu. And so the host becomes less of a factor in the triad. The agent, the flu, is still present, but what we want to try and do is as the host and with regard to the environment, these are things that we actually have some control over and we can hopefully change. And I see that Tracy had 1982, which was really close to the 1981. And that might have been the year that things were sort of implemented in terms of people getting the flu shot working in healthcare settings more routinely. So I know this is like a crash course in science here about the epidemiologic triangle, but I think it's a really important one to think about anytime you think about a cold, a flu, strep throat, which is also going around, I might add. So does anyone have any questions about this? Remember, the agent is the infection. We can't change it, but we as the hosts can take precautions, and we can also change the environment so that we are less likely to have spread.
I wanted to ask you a little bit about your last myth. I never get the flu. I do not need the flu shot. I've heard that from, I don't know, 20 people in my life. And you always just go like, well, lucky you. I mean, I don't know. Because Most people have gotten the flu at some point.
And many people don't recognize that just like COVID, where we have people who are asymptomatic but test positive, roughly 20 to 30% of flu cases are asymptomatic. And people don't realize that. That's why flu spreads in communities so easily, just like COVID.
Didn't know that. Thank you.
Of course. So that, I think, is a great seg into my next slide, because what is the flu exactly? Is it a virus, a bacteria? Many people don't really actually know. It's like portion control. We think we know what we need to do in terms of how to eat well, but if you go to a Weight Watcher meeting, it might be quite different. So the flu it's a virus. It's very contagious, just like COVID. And much to your point right there, Evelyn, as you see here on the slide, 20 to 30% of people carrying influenza have no symptoms. That's what makes it so easy to spread. Here we are, this point in the pandemic, I've never had COVID. So I'm what they call a super dodger. And people are studying the immune systems of people like myself and others who have never tested positive, as far as we know, to see what it is about our immune systems that, for example, might link with not getting COVID. The same is true for the flu. And there are those bunch of people who say, I never get the flu, but it might be that they are asymptomatic, and that is how the flu manifests for them. So they are very fortunate, certainly, but they don't recognize that they can pass the flu on to others. And that's what makes it so dangerous. Now, it is caused it is rather spread through respiratory droplets, just like COVID. And one of the things, like I was saying before, that made COVID so challenging were the people who were asymptomatic. So that's a challenge. There's something else, as I mentioned, called RSV, this respiratory virus that is going around. It is also a virus. Now, viruses cannot be treated with antibiotics, like strep throat. Strep throat, for example, is a bacterial infection, not a viral one. Now, there are antiviral medications, more and more of them now, that help a virus from mutating in the body. And the effect makes the virus then shorter and weaker in duration. But you might have seen on the news just yesterday that they are no longer giving monoclonal antibodies for COVID. There has been a strict halt on that because they have found that it doesn't actually work with our new subvariants. And so, again, science is evolving. We're learning as we go. We don't know that these antivirals necessarily will curtail the symptoms and duration in everyone in the same way, but they're all we have if someone does test positive for the flu. So I had promised that I would share this amazing slide on how to distinguish symptoms between flu, COVID, cold, allergies, RSV, and this comes from one of the largest medical associations. And I would love everyone to please take a look at this wonderful slide here. So how do you distinguish between the symptoms? With great difficulty. And that is why we're seeing so much spread of everything right now. Because if you have any symptoms, you could have anything. A lot of these viruses have many of the same symptoms, including fever, headache, body ache, runny nose, cough, sore throat, sinus congestion. So it's very hard to distinguish. There's way too much overlap. And that's one of the key reasons I'm such a proponent of getting vaccinated. Because if you can take some precaution, why not, as the host, try to be less hospitable? The only way to definitively diagnose or rule out one of these viruses is to get tested. And of all these things, the only thing that you can test for at home, as in terms of these viruses, is for COVID. And we know that the at-home tests are not perfect either. So in order to get diagnosed for the flu or RSV, you would need to go to a doctor's office. The same is true for strep throat. So it also shares some of those symptoms too. And that's why I keep bringing it up, because it is also going around. So as you can see, doctors who might be looking at this, or lay people or caregivers, anyone might be confused. And that's why doctors are urging people to please get vaccinated. Do what you can. Does anyone have any questions about all of these symptoms?
Come on, folks. Questions, comments? Beautiful chart.
Minerva, this was why I wouldn't even venture to guess what you might be feeling.
And while we've been having this lovely presentation, I took the COVID test, so at least I know it's not that.
Woohoo!
That's great.
Now I have 4 more things to choose from.
Or to rule out.
Yes.
Well, allergies, actually, if you have the Weather Channel app on your smartphone, they do include information about allergies going around in your area, which I do find helpful. There is also an app called State of the Air, which is from the National Lung Foundation, and it has great information for people with allergies and asthma as well. All right. So what can caregivers do, knowing all of this, right? So emergency rooms and urgent care centers right now are overwhelmed with people with respiratory infections and symptoms. So you want to ask yourself, are your symptoms getting better or are they getting worse? If they are not getting worse, then you may want to first consult with telehealth or take more conservative precautions, like testing yourself at home for COVID. There are free tests available through private insurance and Medicare, even though I saw so many Cyber Monday deals, interestingly, for COVID tests. I guess for people who don't know that insurance does cover them, or you can get them free from any health department. There is no in-home test for the flu. Now, they are working on it. It might be out by next year at this time, but then one of the other concerns, just like we had for COVID, is that if people are testing in home, how does the data get counted and reported? And how do we really know what outbreak is like? So prevention here is critical. If you are a caregiver and you want to take a loved one to an urgent care center, certainly wear an N95 mask, have hand sanitizer on hand, try to take distance, call a facility first and see if an appointment can be made. Some places are having people wait back in your car until your appointment time. Some other facilities are scaling back on allowing caregivers to be present too. So you may want to first call ahead and see what the precautions are. And also that'll help you feel more confident that you and your loved one are in good hands. Many doctors' offices, hospitals, there are no mask rules in place. And if you look at, as I have at some recent clinic waiting rooms, if people didn't have something, then they certainly will before they leave. Because people are just congregated in waiting rooms and no one's wearing masks. So it is advisable to take precaution and to ask first. And again, if you have an N95 mask on you, that is good precaution. Many people do have access to telehealth. And that is, again, something that you can use as a first step. Now, I mentioned that these antivirals like Tamiflu, they only work if you catch your flu within the first 48 hours of symptoms. That doesn't leave a very large window. So you have to really question whether your symptoms are getting worse. Test yourself for COVID. If it's negative and you think that it might be the flu, then you may want to inquire about Tamiflu. Some telehealth providers are willing to give Tamiflu without actually confirming a test for the flu. It's up to the discretion of your provider, but they are doing this because they're trying to have people avoiding having to come to urgent care centers and be in waiting rooms. Now, again, the flu shot will reduce your risk of developing severe infection or needing to be hospitalized, but you should continue to do whatever you normally would to protect yourself. If you have a compromised immune system, you may have been told to avoid crowds and to keep practicing social distance. I also recommend that people at any large gatherings or events should still consider wearing a mask if you have some concerns. And that is true both for the flu and for COVID. Caregivers can also really reduce the risk for their immunocompromised loved ones, again, by ensuring that they get fully vaccinated, because they then are less able to transmit the flu, hopefully. So I know we have a lot of caregivers participating, and I was curious if anyone had any questions about how to best safeguard themselves during this triple-demic, as it's called, and ahead of holidays.
Please just press *6 on your phone, or you can unmute yourself or go to the chat room. We really would love to hear from you.
I'll share.
Okay.
I
Yeah.
know for some of the family events, being that I'm Hispanic, we do posadas and things like that leading up to the 24th. So one thing we do ask the family members is to get tested first before going. And if we're positive, of course, not go. But if we're negative, even it will be fine. But we do try to wear the masks as much as possible.
And that's really the best thing that you can do.
Yeah, that was great, Minerva. Let me ask you, Dr. Sklar, I know because of the whole politics of COVID, that there are people, particularly during the holidays, who, are angry because they get to someone's house, they've traveled and they're sick. Somebody there is sick. Do you have advice about how to kind of prepare yourself for holiday trips or going to see family in other places?
So I think this sort of circles back to what you were sharing, Minerva. I think everyone is very well intentioned, and we try to protect ourselves and our loved ones as best as we can. But we don't know who in our bubbles, in our families, in our midst might have differing opinions, might not have gotten boosted or vaccinated. And the data is telling us that there are more of those people than we think. So that's why I say that I think a lot of people have not gotten a flu vaccine, as an example, or maybe didn't test themselves for COVID and said that they were fine. It's just the reality, I think, of the circumstances in which we're living. And what I've come to accept is that there will be some level of risk inherent with any gathering. The option then is up to me as the host to make myself less hospitable to those germs and to make my environment less hospitable to transmission. So I can choose to distance myself further away from people, sit further away. I can choose to sit near a window or a door, or I can choose to be outside if that's an option. But I know at this time of the year, it may not be. And I had a very candid conversation, for example, with Lucy this past week about concerns over all of what we're talking about. I went to Art Basel, which is a very, very large art festival in Miami last week. It was the 20th anniversary and the largest art festival that they've ever had. I went to the convention center with my N95 mask, and I was taking photos from the top, from the rafters, of how many people were in that convention center, because I hadn't been in such a congested environment in so long. And I was enjoying myself thoroughly. But being able to walk through all of the art required about 4 miles of walking across all these different walkways. And after 2 hours, I was not comfortable wearing my N95 mask and continuing to walk, and I was sweating and it was uncomfortable. So I had a choice. I could leave the event that I had paid and taken the day off for, or I could take off my mask and feel more physically comfortable, knowing that I could be risking transmission of something with so many people there from all over. And these are the decisions of our reality. There will always be some inherent risk right now in our activities. So I try to take precaution where possible. If I was going to be flying somewhere, I would be wearing a mask on the plane. it's just one example. We know that N95 masks will provide the best protection, but we also know that they're not very comfortable. And when you're in a family gathering and you want to be around people and hug and be close, it's been years really since we've done that without having to weigh these decisions and think about it. And so that's why I share the information. I encourage people to take with it and do what they feel comfortable with, but to assume that when you are in public with others, there will always be some risk right now because the rates of community viral spread are so high. So I know that that's a complex answer, but it's a complex question. And the reason why I think these conversations are so important, because everything assumes some level of risk, including some of the precautions that we're taking.
Like getting shots.
Yes, absolutely. We know, for example, the flu shot, there are some side effects. Some people develop another virus syndrome called Guillain-Barré. It's very, very rare, but it is important to be knowledgeable about the risks of things. And we don't know, for example, the long-term risks of a COVID vaccine. So that's one reason making people less inclined to get their boosters right now. At first, when everyone was dying, we were rushing to get our COVID vaccines because we were scared. Now we're not as scared. And so people are being more thoughtful about the precautions.
A great explanation. Thank you. Of
course. Something I do want, oh, please go ahead.
I was just going to say, other folks have questions, comments? Anybody had the flu yet?
No, thankfully.
Okay.
So I want to just quickly share that if you are someone out there who has not yet gotten your flu shot, that's okay. I did want to make people aware that there are different flu vaccines. There are flu vaccines specifically for seniors and also those with compromised immune systems. The Fluzone high-dose quadrivalent means that you are getting vaccinated against 4 different variants of the flu. It is a higher dose flu virus antigen, which is intended to create a higher immune response, making it more effective. There's also an adjuvanted flu vaccine. And what that means is that it contains an additive that is meant to stimulate a stronger immune response. But both of these are both designed and formulated to protect against 4 strains of the most common flu that are anticipated in any flu season. The good news from the CDC data on one of the links from an earlier slide is that the flu variants that are circulating are those that people are being vaccinated against. So that is good. Studies have found that these higher dose vaccines provide better coverage for seniors specifically. So if you have not gotten vaccinated, and if you are 65 plus, please make sure that you ask for one of these vaccines specifically. Anyone have any questions about that? Something a lot of people don't know about.
I can see your phone and your Zoom number. So if you have a question, please go ahead and I'll call on you. You just explain things so well. Come on. Nobody has a question.
I hope. So I want to leave you all with some tips, tricks, and tools.
Is this dessert?
This is dessert, yes.
Okay.
An ounce of prevention is worth more than a pound of cure. Some of you may have heard that old saying, but it really, really is true. I am a doctor of public health. My area of expertise is in disease prevention and health promotion. They go together. So you can get a flu vaccine, you can do all these great things, but it's very important that we help our own bodies get moving. Exercise is incredibly effective for stress relief, anxiety, but also it helps to train our cardiovascular systems to be more resilient if we do get a respiratory virus, for example. I've joked that I've been training for COVID for the last couple of years because I've been exercising so much, more so since the pandemic began. And I think it's because it's made me feel more aware of my own personal risks and things that I can do to make myself more resilient. One of those things is also taking time for relaxation. And for me, that actually sometimes goes together with the get moving, because I find walking or biking in nature to be very, very therapeutic for me. Some people find relaxation techniques, meditation, yoga, deep breathing, are very helpful in just taking some time to set aside each day. Also getting lots of sleep, eating a well-balanced diet, staying hydrated. We don't realize it, but these are natural things that we do to help protect our bodies and to support our own immune systems. Some people believe in taking vitamins, for example. Whatever works for you, your pharmacist and your doctor. I think that it is just really important that we eat properly, that we make sure that we get sleep, that we don't forget, in place of using hand sanitizer and wearing masks and doing all those things, that there are natural things that we should have always been doing and that we should always continue doing. And so I really recommend that we just be mindful that at this time of the year, especially, we take time for ourselves. Many of us are busy shopping for holiday gifts, but this is a small thing you can do for yourself, the best gift, and it's free. Our health is our wealth, as I always say. And I promised I would leave the one last most important thing that you can do to prevent a flu, RSV, colds, anything, strep throat. Wear an N95 mask consistently. I say, let's pretend it's April 2020 when we were washing our hands like we had just sliced up jalapenos and we're about to change our contact lenses. Keep your distance. And we know that wearing an N95 mask, that is one thing that the research has shown us, that when worn properly and taking proper precautions about making sure your hands are clean when you put it on or off, that's really the best defense that we have right now against all of these things in our environment. So if you are planning on spending time with family members for the holidays, remember that there is a very critical 2-week period prior to Christmas, let's just say, in which you want to be maybe taking more precaution, wearing your N95 mask more. I was invited to a holiday party at the college where I used to teach, and I would love to see all my old colleagues and visit with them. But now is not the time for me to do that. I'm taking 2 weeks off at the end of the year. I don't want to get sick, and it's not going to be pleasant to have to see all of them at distance with N95 masks. So to me, that's how I'm weighing my risk benefit. I want to enjoy my free time off and not be sick for it. So I really recommend that, that you take the precautions necessary, think of important things and people in your life, and act as needed. So I wanted to ask if anyone had any questions. Thank you, Tracy, for your comment. I am very honored to always provide information and to share. We also do have some resources as well. As I mentioned, there are some hyperlinks earlier in the presentation, but we have the weekly CDC Flu Map here, the COVID map by county, the Johns Hopkins COVID map as well. But remember, as I mentioned, because people are testing at home, these data sources are not at all as accurate as they used to be. And if you're having any feelings of anxiety about any of these risks or anything at all, please remember that 988 is a crisis helpline hotline, free for anyone. You can call from any phone. It is anonymous. No insurance information is asked, and you can speak with a trained professional. Because now is also a time when our mental health is so important around the holidays, and especially as we're dealing with more viruses and illness and sickness. So I hope everyone stays in good health and enjoys their holidays. Any last questions? Yes.
You mentioned a website called the State of the Air.
It's an app. It's an app that you can find in the App Store.
Oh, okay.
And it is from the, if I'm not mistaken, the National Lung Foundation. I will look right now to make exact sure. It was recommended to me by an asthma specialist. And it provides great information about what allergens are in our air. And I'm trying to find
Turn on the heater again.
not that, but it is called State of the Air.
You're under your shoulder arm.
Okay. I have a couple of announcements that I'd like to make, but first I want to tell you, Elliot, I always learn so much from you, and I so appreciate all the work that you put into this. It was
Thank you.
great. I learned so much. I second what Tracy said. It was just, full of information that I didn't know. Okay, I'm going
And we
to,
just appreciate also.
I'm going to find out who that is.
That was Charles, and thank you so much for the comment. And
Okay.
the State of the Air app is provided by the American Lung Association.
Okay, great. Thank you so much. The American Lung Association. Okay, American Lung. All right. So we have some really great stuff coming up for you. And a lot of it has to do with the holidays, how to keep our cool in life and over the holidays with Dr. Jamie Heisman. We've got Dear Lucy, and that'll be tomorrow. And then on Thursday, we've got Dear Lucy, Who Am I? And she's going to talk about how caregivers sometimes lose their own sense of identity as they get so tightly wound around the person that they're caring for. That should be a very interesting one. And then on Monday, we've got Managing the Holidays, interactive discussion about how to cope. And so there'll be a lot of exchange between the people on the phone. On Tuesday, the 13th, we've got Dr. Pradario, who's a fabulous presenter, and he's going to do something in Spanish, and it will be how to recognize the effects of stress during the holidays. We have on December 15th, understanding the neuropathology of Alzheimer's disease and related dementias. It should be really interesting. We're going to see PET scans and kind of what they look like, their differences, with dementias. And then for a special treat on Friday, December 16th, Galinda Rogers and I, the Talking Heads, are going to present Avoiding the Potholes of the Dementia Journey. So we won't want you to miss that one. That will be fun. And with that, I want to thank you all so much. I am going to stop the recording. We are so happy you've been with us, and thank the WellMed Charitable Foundation for sponsoring this. And again, Elliot, thank you so much.
Thank you. Happy holidays, everyone. Stay healthy.
Yes. Okay. And just stop recording.